What's the most shocking thing you saw in Minnesota?
The weaponization of fraud. When you're elected to office, there's some rules that you're obliged to follow, but there's always the opportunity for political patronage. Doing favors for people can help you back. And it's not always transparent to the voter, but by federal law, if I sign you up for Medicaid, I have to offer you voter ID. So it's basically a voter enrichment and enrollment process. And in Minnesota, I really think having been there, interviewed folks who work in their Department of Health and Human Services, that there was a almost purposeful desire not to look carefully. And it wasn't just in Minnesota. It was in Washington. The program that we have that audits Medicaid was gutted. There wasn't really a desire to focus on program integrity, like who's supposed to be on insurance, who's not, because just give it to more people and we're better off. The problem is you should need to actually deserve to be on the program, because if you don't deserve to be on the program and you get all the benefits, you actually reduce our ability to help the people who deserve to be on the program.
How big do you estimate the Medicaid fraud to be?
$100 billion. $100 billion. That money should go back to making the Medicare trust fund solvent for many years. It should go back to providing adequate, high-quality services for mental health conditions. It should allow us to take better care of people in rural parts of the country, underserved parts of the country. But we look at numbers now, like in Southern California, where you have a 7-fold increase in hospice. Doesn't make any sense. I think 30% of hospice in the entire country must be down there. I sent a letter to our good friend, Governor Newsom, concerned about the massive increase in home health care in California, where literally $1 in $10 spent in the entire country in home health care is in LA, not California, LA. It should be, a third of that. And I went after it because I know this is the same organized criminal efforts. By the way, these are not accidents. These are often foreign nationals. Mm-hmm. We've got Russians in California who fled back to Russia when they got indicted. We have Cuban-run strings, which we believe the Cuban government's involved in with durable medical equipment. That's the people who sell you wheelchairs and canes. This stat's going to blow your mind. There are 20 times more durable medical equipment providers in South Florida than McDonald's. You need 20 times more wheelchairs than burgers. It's just bizarre. I mean, how could you? And you have to, again, almost not be looking. We have more personal care services in New York. I mentioned the retail. I mean, it's just way beyond what you'd imagine.
Centers for Medicare and Medicaid Services, CMS Administrator, Dr. Oz. He detailed yesterday what he described as the weaponization of fraud, Minnesota, estimating $100 billion. Is that shocking? Is that surprising? Not at all. Not at all. You got 19 billion or so. I mean, who's counting in Minnesota? You got who knows how many billion here in Washington State. I mean, anywhere you've got these huge immigrant communities, it's a deal where most of them are on welfare. They're taking money. They're on the dole. And oftentimes, even after 10 years, they're still on the dole. Vast majority of their communities. So they're not integrating. They're just coming to the U.S. and they are, you've got immigration, but you don't have immigration of the best and the brightest. Somalis, I mean, just not exactly the smartest group out there. And I'm not trying to hammer on them specifically, but if you Google what their average IQ is, it's like 68, 70. It's borderline mental, right? So they don't even have the ability to really go out and get jobs. They just need that handout. So in communities like Minnesota, Minneapolis, they bring those folks in because they know as long as they're on the dole with their hand out, taking taxpayer money, they're going to vote Democrat. And that is why there's such an uproar over ICE tossing all these illegal alien immigrants. Appearing on the Katie Miller podcast, Oz was asked by host Katie Miller what the most shocking thing he saw. Weaponization of fraud. That is what it is. It's weaponization of fraud. And, we've been hearing these stories of fraud pop up. What I think is so funny is Nick Shirley, some 23-year-old kid. There any kids in there? You guys are claiming that you're a daycare. Is there any kids in there? And it just gets everybody worked up. And then you get people all over the U.S. Nick's down in, I think he's in Los Angeles right now. I don't see any kids running around. What's the dealio? You know, it's not that hard to figure out that there is massive, massive scale of weaponization of fraud. What is so crazy is when asked, the mayor of Seattle basically says, he is asked, are you guys going to investigate the Smalley fraud? They're like, no, we're not. Why not? Oh, because if you investigated that, that's money being taken out of that community, and you probably toss a bunch of those community members, and those are your illegal voters. Oh, I get it. Okay. Yeah, that makes sense. Makes total sense. So weaponization of fraud, when you're elected to office, there are some rules, we heard him say this, that you're obliged to follow, but there's always the opportunity for political patronage. Oh, a little money going this way, a little money going to an NGO here. I mean, it's like the billions and billions of dollars that are being spent oftentimes by taxpayer-funded NGOs to protest ICE. I mean, when are those guys going to get tired of that? When's that just going to, we're close to that now. I mean, we got to be on to something new here pretty soon, right? And then we'll go, hey, remember when you were doing swastikas on Elon Musk's cars, the Tesla? Remember when you were doing that? Yeah, that was stupid. Remember when you were protesting ICE? Yeah, that was just head-shakingly stupid. Remember when you were protesting police officers and you defunded the police? What happened with that whole thing? Did crime explode? Did the murder rate explode all across Oh, it did? It did. It did, because since Trump's been in office, those murder rates have dropped a lot. Washington, D.C. Now, some of that's because you're coming off of absolute peak numbers, because you had peak numbers. Because there's no social services that would normally kind of keep these animals from not killing each other. And then all of a sudden, game on, folks. Just people shooting each other left and right. That whole thing. Former host of the Dr. Oz Show explained how doing favors for people can provide lucrative opportunities for those working in state health departments in ways that are not always transparent to the voter. That's why we need voter ID. And we also need to go back to in-person voting. You need to make that a federal thing. You got to go to the poll. And show your ID. You got to show your ID, just period, right? I mean, this whole argument that, what is it, black people can't get a voter ID is just astoundingly stupid, because it's simply not true. We make all these inroads about, we've got DEI hires, didn't earn it, okay? But then you turn right back around and say that, minorities can't get IDs because they don't have copy machines? You're like, what? What is wrong with you? You are mentally challenged. So it's basically a voter enrichment and enrollment process. And in Minnesota, I really think, having been there, interviewed folks who work in their Department of Health and Human Services, that there was an almost purposeful desire not to look carefully. And it wasn't just in Minnesota. It was in Washington, meaning Washington, D.C. It's happening. Program that we have that audits Medicaid was gutted. Weird. So you're just kind of letting programs run? You are. And then you're surprised when there's $100 billion in fraud? Are we just getting to the point where we're just throwing out fraud numbers? Massive, massive fraud numbers. Kind of feels like that, doesn't it? During his investigation, Oz found there really wasn't a desire to focus on program integrity. Well, no, because if there's no program integrity, you can do whatever the F you want, right? You can just run things however you want. Hey, yeah. You want to vote? I know you're not legal, but you want to vote? I mean, who's looking? Who's looking? And these daycares that are getting hundreds of thousands, sometimes into the low millions of dollars. And you're like, how many children are you qualified for? 4? You're getting 1.3 million over a couple of years? Astounding. And that's daycare fraud, right? Daycare fraud. Different than Medicaid fraud. He added that this is happening due to the assumption by state administrators that more people enrolled in the program, the better. No, I say fewer. Because it's tax dollars funding this, right? It's just insanity. But you know what? Live in a blue state, that's what you're going to get. You're going to get just a bunch of morons go, oh, more people on the dole, the better. Problem is, you need to actually deserve to be on the program. Oh, no, you don't, Dr. Oz. I used to love watching Dr. Oz do his little clips on the Opie show, Oprah Winfrey. And I think it's so funny that he's basically conservative now, and Oprah Winfrey is just out of touch, wildly out of touch with just anything in reality. I never really liked Oprah Winfrey, but I thought Dr. Oz, every now and then, had something good to say. And I just kind of like his position now. And it's like, there's a celebrity that, didn't fall for your whole hook, line, and sinker of just mental retardation, right? You actually reduce our ability to help the people who deserve to be on the program, he argued. 100 billion, he replied, money that should be going back to make the Medicare trust fund solvent. That money's not going back. It's gone. It's spent. It's spent on an annual basis or whatever. But we look at numbers now in Southern California, we have 7-fold increase in hospice. Some of the other stats here are just, they're crazy. He goes on to say that literally $1 in $10 in the entire country on home health care is in LA, not California, LA. That's weird, isn't it? Isn't that kind of strange? And that the appropriate number should be a third of that. You've got massive amounts of just straight up fraud. Because the numbers don't make sense. The math isn't mathing, right? Dr. Oz said that there are 20 times more durable medical equipment providers in South Florida than McDonald's. Yeah, how is that? You got an old population? Okay, all right. But the elderly eat hamburgers too, right? I mean, those cheeseburgers, those are soft. I mean, you don't really have to chew on those much at all. It's not like you're eating a steak, right? You're eating a McDonald's cheeseburger. I don't know if you've seen the size of a McDonald's cheeseburger lately, but they're damn near as small as a 50-cent piece, right? They are small. Absolutely tiny. I love how he calls out the Ruskies. By the way, these aren't accidents. These are often foreign nationals. We've got Russians in California who fled back to Russia when they got indicted. Oh, that's classic. He's just calling them out. We have Cuban-run strings, which we believe the Cuban government's involved in with durable medical equipment. That's the people who sell you wheelchairs and canes. Why wouldn't they? Right? Why wouldn't they? Here's another fraud situation sent to me by a valued, loyal, longtime listener. Sent me the text. Local politicians, we're talking about Atlanta specifically. Here's the timeline. Number 1, you open the store. Number 2, you apply for a bank loan. You don't have adequate documentation. You don't have adequate tax records. You don't have really adequate anything. So you get denied. And then you, of course, accuse the bank of racism. Okay, all right, that's go to. Yep, that makes sense. Then you get the bank loan. And then you have a fire. A fire miraculously destroys said inventory and business. And then you claim insurance. Have we heard that one before? Absolutely. 100%. Now, you could have all kinds of different variations. But yeah, it's out there. It's a known quantity. It's a known thing. And to think that that is not out there based on the numbers that we are seeing, when Dr. Oz, it just seems like we're in a fairy tale, right? I like Dr. Oz. But Dr. Oz is our director of Medicaid, Medicare. Literally, sometimes you wake up and you're like, we are living in the down under. How does this make any sense whatsoever? I don't know. But with Dr. Oz, I'm okay with it. And that's why I did this podcast. Because there's so much fraud out there right now that's kind of having the lid lifted just a little bit. But are we really going to do anything about it? I don't know. It's structural to a lot of these political environments. It's wildly structural. They're not going to give that up easy. That's why they're going hard on ICE. Get ICE out of here. They're scaring us. And then the voter ID. Oh, we can't have that because, some of our constituents, they can't work out how to get an ID. And you're like, that is such nonsense. Absolute nonsense. Kind of like $100 billion in fraud across the United States. Medicaid. Whew, head shaker. That's it for me on this one. Thanks so much for being here. I'd love to have you subscribe, hit that notification bell. I'll see you in the next episode. Bye for now.